Here we go. Okay.
Welcome, everyone. My name is Miles Griffis. I am one of the co-founders of the Sick Times, and I am the executive editor.
Hey, I'm Heather, and I am our engagement editor. I do all the stuff you see on social media.
Delphi, do you want to go?
Yes, I'm Delphi. I'm from Argentina. I'm a summer intern in the Sick Times. And yeah, I'm studying here in New York.
James, are you around right now? All good. We'll move on. Go ahead.
Okay. Cool.
All right. So, yeah, we'll just give a brief rundown of what we're doing. We're going to sort of break down our financials in a little bit and what we're working on. But yeah, we launched in the fall of 2023, and our mission hasn't changed. It's journalism by and for the long COVID community. We write news stories, essays, op-eds, covering science, health, policy, arts, and more. And our tagline, as always, for our site and on our podcast is no denial, minimizing or gaslighting here, just sort of as a counter to so much long COVID news and commentary that we see elsewhere in mainstream and other publications.
Yeah, so we wanted to talk about just give everybody a heads up about some stories we have coming later in the summer and fall, just to try and be more transparent about our coverage. So one thing that I'm really excited about is we're working on this series about promising clinical trials and study design considerations. So we published the first story in that series earlier this week. It was a piece that I wrote about the German drug BC007 or 007. I don't, I haven't actually said it aloud that much, but I assume that's how you say it. And so we have a few more stories coming up in that series about drugs, including rapamycin, JAK-STAT inhibitors, Paxlovid, monoclonal antibodies, and bezisterim, the trial from BioV that started recently. So with these stories, we're really trying to think about try what are some of the commonalities in some of these trials? What are researchers thinking about as they're designing these studies, particularly as we're now in kind of a second round of clinical trials? Like we had some trials that kind of started in the last couple of years from Recover, some of the earlier Paxlovid studies, and researchers have learned a lot from those, and are kind of trying to like carry things forward. And bring some of that information about things like outcomes measures and um, uh, participation criteria and all of this stuff into their kind of next round of studies. So we're really trying to understand some of that and also give you all more information as you're, following these trials and waiting for results to come out. Like we want people to really have what they need to understand the papers and the press releases from these kinds of from these companies. Another thing that we're doing that we're super excited about is planning to cover two upcoming research meetings. One is the Keystone Symposium meeting in Santa Fe that's happening in a couple weeks. Miles and I are both going in person, and so we're very stoked about that. We're going to be covering the research, meeting folks. And then I am also planning to attend the Recover workshop in September that was announced recently. It's going to be in Bethesda, Maryland, and is kind of the round two after they had a similar hybrid meeting last year. Some other projects. So Delphi, who you heard from a bit ago, is working on a big project looking at long COVID clinics. So we're really trying to understand like what are some of the places in the US that are still offering specialty long COVID care? What are some of the places that have stopped doing that? Why have they stopped doing that? I think we've all kind of anecdotally heard this trend that it seems like a lot of clinics have been closing. And certainly we've covered and shared stories about like a few prominent examples, but we want to try and understand this in a more systemic level. So one thing that we're kind of doing along those lines is Delphi's put together a survey for clinics to try and understand more of what they're offering, where their funding's coming from, and also for those that have maybe stopped offering long COVID specialty care, like why. So Delphi, if you want to maybe put that in the chat, we're encouraging folks to try and kind of help share that. If you happen to go to a long COVID clinic, or if you know of researchers or clinicians who are involved with one, we're kind of trying to share this around and collect some data. Um, Plus, of course, we're continuing to follow the Trump administration. Always a lot going on there. So we really try to focus on what's most relevant to the long COVID community, to the ME and related infection-associated chronic disease communities. So really trying to cover those specific stories and things that other science and health outlets might not be doing. So tips and information questions on that are always very welcome. Plus, we have some essays and op-eds coming that we're excited about, including more pieces in our Color of Long COVID series that is supported by the Disability Visibility Project, and a few focused on specific like advocacy ideas and goals. Um, yeah. Miles, and am I missing anything about all this?
No, we have a lot planned. Yeah, I can briefly answer Kevin's question too. We don't have any stories on this IVIG right now, but IVIG is definitely something we are looking to cover more in depth. So it's definitely something we can look into more later this fall.
Yeah, we know one of the first round of Recover trials was about IVIG. So that's definitely something we'll be following when the results from that are available.
Yeah, so we just also always just want to remind people that our publication really wouldn't exist without our freelance writers and people who help contribute in a lot of different ways. So we still are open for pitches for either reported stories or for essays or op-eds. So yeah, we're really looking for unique sort of arguments for op-eds that haven't been talked about too much in the community. We're looking for sort of unique personal essays that say a lot about getting care for long COVID, research for long COVID. Um, so we have more guidelines on our website that you can find at thesicktimes.org. But we recommend pitching, sending writing clips if you have them, and it's totally okay if you don't. We work with a lot of writers who have not been published before. Um, yeah, so that is one way you can get involved. Yep. And then the other way is through tips. So um, if you don't want to be involved with the writing of the story, but you maybe want to be a source or you just want to pass something along to us to look into, you can reach us either over email at editors@thesicktimes.org, or you can find Betsy and I's signals, which are sort of a more secure way to contact us if you have really, a tip that you don't want shared anywhere else. That's one way you can also reach out to us, and we will check those out and get back to you and see how we can work on a story.
Yeah, I wanted to clarify this because sometimes people email us with like information and we don't quite know what their intention is, whether it's something they want to write or something that they want us to cover. So kind of clarifying that like this is very journalism-y lingo, a tip versus a pitch. Sort of helpful to explain the kinds of ways that you can share things with us. I also wanted to share some of the topics that we're really hoping to cover more in the coming months. Things that we think have been sort of underrepresented in a lot of the media on long COVID. So a big one, of course, is long COVID in kids. We've done a couple stories about this, but it's such a huge topic and there's always room for more. Another is post-vaccine syndrome. or like post-vax long haulers. We actually have an essay coming out tomorrow that covers this topic that we're super excited to share. But definitely want to keep covering this and keep including those folks and those issues, research, etc. in what we're covering. And then a couple others are more of the intersections with between long COVID and related diseases and poverty and labor issues. Just things we know are huge, and there's a lot to cover there. More of the underlying biology of long COVID and other chronic infection-associated chronic conditions, um, as well as international stories, of course. So to the question in the chat, yes, we love international pitches, and we have worked with many great writers in other countries.
Yes, so and another way to sort of give us feedback is through just emailing us if there's a story that you want to comment more on. You can always reach out to us at editors@thesicktimes.org. Commenting on social media, we're on Blue Sky, we're on X, we're on Instagram, we're on Threads. We are on YouTube, but not too much. And those are sort of our main channels. Another option that we've been doing more of recently is letters to the editor. And, sometimes it's helpful to hear from the community. We published a story earlier this year, and we were covering a long COVID clinic, and a writer reached out to us and sort of stated that it wasn't doing as good of a job um, as they could be, and that they actually were recommending graded exercise therapy at this clinic. And our reporting didn't find that initially, so that was a really important thing to share with the community. So we usually will like help just edit an email, and then kind of put it into like 200 to 300 words that we can then share with the community. So um, these can be, never required, but if it's something you would like to share with the community, or thought we missed something, or thought we did well on something, or want to add to our reporting, uh, these these letters to the editor are a really great way to do that.
Yeah, it's basically like an extended comment that kind of gets amplified a little bit more because we publish it on our website. And it's linked back to the original story. Um, I also wanted to say with regards to social media comments, of course we're a small team, so we're not always necessarily replying to everything, but we definitely do oh sorry. That's fine. We definitely read all the comments, and we take things into consideration. Um, yeah. So another thing we wanted to talk about with this meeting is some of our financial stuff because we are fundraising at the moment. And we know that, unfortunately, the with a lack of government and institutional support for long COVID and related diseases and issues, we know a lot of organizations, including advocacy and research orgs, are fundraising and are trying to raise money kind of in similar ways to us. So we think it's really important that we give you all information about why exactly we are asking for your support, what we're doing with it. So that's kind of the part of the intention of this meeting. And we really encourage you all to ask any questions that you have if anything is unclear or anything like that. So this slide is kind of our current monthly budget. As you can see, the majority of it is staff. All of us who you see on this call, paying our stipends. Miles and I are kind of close to full time, not really at like full salaries, but generally kind of working in that capacity, while Heather and James are both part time. And then also freelance contributors. It's super important to us that we pay all of the writers that we work with, and yeah, pay a decent rate. I think our rates are pretty good for the size of publication that we are and for how new we are. So we're proud of that. We're glad that we're able to offer that to writers. We also have some smaller expenses like paying for our website, reporting tools like Zoom, of course, and travel when we're going to these research meetings that I mentioned. So in current terms of where we're at in 2025, so we have had a lot of success with fundraising in the last year and a half or so. The biggest win, of course, was the startup grant that we received from the biotech fund Canro, which folks may know has supported a lot of long COVID research as well, including projects like the Patient-Led Research Collaborative and PolyBio. So they gave us a grant much smaller than a research grant because we're a news organization. It costs much less to write about clinical trials than it does to run clinical trials. But still, so we were very grateful for this grant that we received last year and sort of had budgeted out through like the rest of 2024 at the time and 2025. And then a bunch of our funding for this year also came from Newsmatch, which was our end of year fundraiser that we participated in through the help of the Institute for Nonprofit News, which is a membership organization for nonprofit newsrooms like ours that we're part of. And they basically give you a lot of support with your end of year fundraising, including helping you with things like email templates, like a schedule, helping you get matching funds, which is when members of your community essentially double smaller donations. And also, they offer some bonuses that we were excited to be eligible for. And then we're also working on our summer fundraiser at the moment. And we've gotten a couple of additional grants earlier in the year. So that's kind of where we're at. We're basically in good shape to continue at our current budget through the rest of this year. And our summer fundraiser in particular, the goal with that is to help kind of extend what we're doing into 2026. Um, so we're pretty on track to basically help fund the first couple of months of 2026, which is really great and exciting. Just knowing that we're gonna kind of keep building the runway as we continue reporting and continue to do the work that we're doing. Um, yeah. And then obviously we have a lot of kind of irons in the fire as we're trying to work on more fundraising and preparing for our startup grant to conclude. So in addition to reader fundraisers like the one that we're doing right now, we're working on looking for new grant opportunities. We're participating in a couple of like journalism support and training programs to help us pursue more grants, more donations, as well as sponsorships. So like the small ads that you see in newsletters. We had the first one of those a couple weeks ago, and we're going to start doing more of them through this program with the nonprofit News Revenue Hub. I know, Miles, maybe you want to talk a bit more about the ads and sponsorship stuff.
Yeah, so this is just sort of one way that we are looking at just becoming a more sustainable newsroom. Um, so with the News Revenue Hub, we've been working with a team that has sort of helped us like place. They basically help a lot of different nonprofit newsrooms um, get sponsorships for newsletters and on their site and other places. So we debuted one for the first time 2 weeks ago, and then we'll have another one coming next week. So these are just one ad that is in our newsletter. Just kind of, it's not every week. It's just sort of on a scale. If there's like someone, if there's sort of a decent match that helps with our, that kind of aligns more with our missions. So we're super open to feedback on this. This is our first time doing this month. Um, so we really welcome any feedback as you check out our newsletters or our, um, if we get to a place where we're advertising on our actual website. Um, yeah, so it's an exciting step. But yeah, we really want to hear from our readers about what you think of it and what ads you would like to see. Um, I think we're definitely trying to, find things that are really relevant to the community. So some of my goals are to work with advertisers who do good things within the community and recommend
Nice.
to other people with long COVID.
And we got a couple of questions in the registration form about how folks can help support us, which we appreciate, of course. So a few things, obviously continuing to read our work and give us feedback, obviously is huge. We really want to be serving you, our readers, serving the long COVID community. So knowing what you think and how we're doing is always really helpful. Also, sharing our stories, sharing things on social media, forwarding our newsletter to a friend or family member who you might think would find it helpful. That's always great. And as we were talking about, sending us story ideas, questions, feedback, helping us connect to grants or to foundations that you think might be a good fit for us, forwarding us some grant announcement you saw. Even if it's like not entirely relevant, we still really appreciate it. And we try to keep track of everything. We have like an internal database of all this stuff. And of course, if it's feasible, we really appreciate particularly monthly donations as we're trying to work on becoming more sustainable. Just having those donations that we know like we can count on you for is just so helpful, like really at any amount. There's a reason why all the public media stations like say this. Like it really is incredibly helpful and we really do appreciate it. But of course, we also recognize that that's not in the cards for everyone, which is why we are really committed to keeping all our work free, never having a paywall, and so forth. Um, yeah. So I think that's it from our slides. We wanted to really just like open it up to you all's questions. Um, yeah, let me stop sharing. Okay. Um, I saw a couple of people have raised hands. I guess, Angela, do you want to maybe put your question in the chat or come off mic or come off mute?
I can come off mute. Hi, can you guys hear me?
Yes.
Okay. Hi. So I mentioned in the chat, so I'm an undergrad. I'm a COVID conscious undergrad in Canada, but I'm actually originally from the Northeast in the States. And I also work in student journalism. So I have two questions. One is, I'm curious if you're planning to focus or bring in any contributors from the post-secondary sphere, just because COVID and long COVID are also affecting a lot of young people. And there's a lot of, at least from what I heard, like lack of awareness on that sphere over in like universities and colleges up here. The other is when you talk about freelance like contributors, I know you mentioned there are paid freelancers. Are there also opportunities for like volunteering, um, like contributing or kind of being a part of the day to day on a volunteer basis?
Yeah, both good questions. Yes. So James just put it in the chat. We did just publish like an excellent commentary piece about long COVID in universities by a writer named Stephanie Castaneda Perez. Really, really great piece. Definitely encourage folks to check it out. But of course, always welcome to more pitches and really just any arguments that you really would want the rest of the long COVID community or other folks to consider. So that's one thing. In terms of freelance opportunities, we are pretty strict about um, having paid contributors and not working with volunteers, just because we think
Here,
it's
over
really
here.
important for people to be
No, no.
compensated for their work, especially given the like energy limitations and
Here,
symptoms
over
of
here.
long COVID. Um, we know that writing an article, it's not nothing. It can be a lot of work, and so we really want to recognize that. And it's also kind of a bandwidth thing on our end. That the level of our freelance budget and capacity also works well for us as editors. So that's kind of two sides of the coin there. I don't know, Miles, if I miss anything.
No, that's all about right. Yeah, I mean, I think we definitely have more plans. Long COVID, as you noted, is so common in younger adults and also in children. So we definitely have a lot of plans to continue covering those issues from more angles. I think it'd be great to do like a reported piece on, I've thought about doing like a reported piece on uh, people experiencing long COVID in college, and university. Um, so we definitely have more plans to keep looking into this, and I mean, there's just so many story ideas that I wish we could cover all of them. But that's definitely something we're looking more into.
Okay, thank you guys so much.
Of course, thanks, Angela.
Thank you. Gabriella, would you like to unmute or put your question in the chat?
Hi, I can unmute. First, I want to say thank you for having this town hall. Super informative. It's amazing to see what's going on behind the scenes. I'm a freelance reporter, and I had a question about how your team sources your public health data. I recently read an article about how it's becoming harder and harder to access public health data simply because it's disappearing, right? As we see, like a lot of like the HHS is pretty much like defunct, and other sources for gathering like federal data on public health are becoming more and more scarce by the day. And so I wanted to ask you guys, like, how is it that you find your public health data? Is it ever a roadblock? Um, yeah.
Yeah. So as the person who writes our weekly COVID data updates, I can talk about this. So I primarily use CDC data as well as a couple of outside sources for wastewater surveillance. Wastewater Scan and BioBot Analytics are the big ones. But there are a couple other, like I sometimes look at state and local dashboards, for example. Um, so I think it's kind of a complex issue because there is actually still a decent amount of routine public health surveillance going on. It's just that things are maybe less trustworthy than they used to be. But I also am always careful to say when I'm asked about this kind of thing that it's not as though it was like Trump came into office and then bam, like no data. There's really been sort of a slow shift in this over the last few years, particularly the end of the public health emergency under Biden in May of 2023 was really one of the bigger shifts in data availability because a lot of data collection programs such as collecting COVID data from hospitals, collecting case information, was tied to the federal public health emergency. And so when that ended, a lot of those programs stopped. So that was in 2023, right? That was a couple of years ago. And so a lot of the more smaller scale, but still like continuous surveillance programs on things like emergency departments and a small number, like a kind of selection of PCR testing labs that report to the CDC. Like those have all continued. It's just that you really have to take everything with a grain of salt, especially in the presentation. I think we all know that the CDC's COVID dashboard is not great at accurately presenting the risk of this virus, to kind of put it mildly. So that's something I frequently talk about in my updates as well. And also corroborating from the CDC with more independent sources like the wastewater data pages, state level data sources that are less tied to HHS kind of explicitly. So all of that stuff. But if you want to like email me and chat about this more, I'm also happy to do that because I know it's a huge topic.
Thank you so much. That was super informative.
Are there questions from the chat? I don't know, like I know Heather and James, you all have been monitoring this that we should talk about.
Yeah, I think there's a podcast question. James, if you are here, I saw you chatting in the chat.
Yeah, hi. I just saw Tanya, I don't know if you want to unmute and ask your question, or I can read it, but
Sure. Or yeah, if you want to read it, I would love to hear your response. Thank you so much.
Yeah, so for folks who are maybe not looking at the chat right now, Tanya asked, how can we suggest topics or guests for the podcast, and what if we would like to be on the podcast as advocates if our speaker strengths are speaking, not writing. So I would say if you're interested in suggesting topics, definitely just email me at the sick time, James at thesicktimes.org. I think that's the same in terms of like being on the podcast as advocates. I think right now a lot of our podcast episodes have focused on recapping some of the stories that we do for the sick times, and talking with sources there. But I think we are definitely open to, we've done a couple of like two-way episodes in the past with folks who are organizers or just other folks in the community who are advocates. Like, for example, we did a two-way recently with Paul Hennessy, who works for Mask Together America, but has also done a lot of like local LA organizing around COVID prevention and long COVID. So, we definitely have space to do some of those like, one-on-one two-way episodes as well.
Cool. Thank you.
Uh, we have a couple more questions from the chat. One person would love to know if we have any plans to publish in other languages.
Oh, that's a good question. Um, yeah, I think we've thought about this a little bit. There are some newer tools that I think other publications are using to try and like help um, translate their stories. We need to look into it more though, because we're not sure like how accurate those are or what's kind of involved with that process. But yeah, it's something we've thought a little bit about. Certainly, if you have any recommendations for tools that you've seen used or other sites that you think like do a good job of this, we would be super appreciative. Um, oh,
We have Anna. Anna, would you like to ask your question?
I would.
Oh, was Anna still here?
No, I am. I would like to
Okay.
ask a question, please.
Sure. Yeah,
sure.
let's go for it. And then we'll get to Ezra. Go ahead, Catherine.
Oh, what I want to know is what's going on with Kennedy and Trump. It's driving me absolutely crazy. I can't do X. I can't get any response. They're doing nothing. What have you people found?
Yeah, I mean, we've seen. Are you just, do you mean sort of like in terms of like long COVID research and long COVID policy stuff, or just overall in general?
Everything, and
Everything.
the research, the everything, the
Yeah,
cure, everything, anything. I have a very serious case. I've been diagnosed with a serious case from James Patterson, if you're familiar with him, in California, and it's 4.5 years out, I'm bedbound,
got it.
and I'm desperate.
Yeah, I mean, so what we've been covering the Trump administration since it started in January. Um, Essentially, the spark notes are like they have taken away a lot of funding for long COVID. They've stopped a lot of data sets on long COVID. And a lot of advocates are sort of arguing that long COVID is being like specifically targeted. And it's confusing because Kennedy in his confirmation hearing and like while under oath has multiple times, I think twice now, said that he will prioritize long COVID research. But they've gotten rid of advisory committees on long COVID. They've gotten rid of the long COVID Office of Research and Practice, which was like coordinating all of the long COVID research and care and just sort of understanding in the government about long COVID. Um, what are the other big things? They tried to take away funding for research, and we reported on that. And the next day, a lot of that got restored. Us and CNN. Um, so it's been a really difficult administration because they have basically taken away like the good things that were happening for long COVID. A lot of them have been impacted. We know so far that it looks like Recover TLC is still going forward. They're having a meeting in September that Betsy's going to. Um, so we assume that that funding is still there. Um, so while it's disappointing that a lot of this has been happening, there are still good long COVID clinical trials from the government that are happening. We'll see what Recovered TLC releases and what their trials are soon. But right now we don't fully know. But there are some other good trials that are happening, both federally funded and um, through other private researchers. So I think a lot of people are kind of putting their hope into these separate trials that are happening outside of the government or underneath it and are still going forward. For like, if you want sort of like a longer deep dive, Betsy and I were on the podcast called The Death Panel.
Literally
Um,
just gonna say that. I'll put the
and,
link in the chat.
and we summarized a lot of this in like an hour so you can get more of the context around it. Um, but yeah, it's been a really, really difficult year.
Thank you,
Yeah.
Miles. I appreciate anything you can do getting them working on it.
Yeah.
Yeah, we're pretty specific about covering the impacts for COVID-19 and long COVID, but there are a lot of other great publications covering broader stuff, like Stat News, KFF Health News, and if you're looking for more political coverage, there's a lot out there. I know like Wired is one place that's been doing a lot of good reporting in the last few months. So a lot of options. We're just like one kind of piece of the um, the journalism ecosystem there. Um, but yeah, I put the link to the Death Panel episode in the chat if folks want to check that out for more of like
Thank
a
you.
big picture summary. Yeah.
Thank you. I'm not necessarily into the political, but I want any answers I can get anywhere.
Yeah.
That's all. I just, I want be over it.
Yeah. Yeah,
Yeah.
we do too. It's
Yeah.
gonna be a long remaining 3.5 years, I think, or
Oh,
who
oh
knows what will
boy.
happen next.
Oh.
But yeah,
Thank you.
yeah.
Thanks so much.
Ezra, you had a question too, right?
Yeah, thanks for doing this. I was reminiscing during your presentation back to the town hall you had before you launched. And I think that was the first time we connected then. And I just wanted to like recognize how far you all have come in that time. I mean, you've really transformed the landscape of this kind of reporting, I believe, in a really significant and powerful way. And so I know that the work of building an organization is really difficult. And I admire all of you on the team for doing that. Probably not, you're not certainly not getting rich doing this. It's a labor of love. And it means a lot to me personally and to the community. So I wanted to thank you. The question I wanted to ask is sort of along those lines, which is that I think one of the things that's been frustrating to many of us in the community is how difficult it's been for stories about long COVID, IACCs, ME, post-vaccination syndrome, all the stuff that we're talking about, how difficult it is for those to break through into the popular media. And from your perspective as folks that are actually working with other publications and maybe a little bit closer to kind of tracking how this has been over time, I'm curious if you've noticed any changes. Is it just kind of the same status quo where we're off on the side, kind of doing the thing for our mini community that is growing by the day, or do you see any change in interest or seriousness with which these problems are being taken by the other folks in the media?
That's a great question. Thank you so much first for just your kind words. We really appreciate it. Um, yeah, I mean, one of our goals that we've been trying to do more of is like more of these collaborations. So Betsy's piece this week we published with Stat News, which was great. So anytime we can combine and collaborate with another news source, we're getting more information on long COVID to people, that we're able to like be a part of the editing process. Um, and there seems to be a lot more willingness in those collaborations. Like, um, we don't pitch a ton just because of our capacity, but when we do, they tend to be accepted. So I would say that a lot of people are interested in these stories on long COVID. I personally feel like with all the trials, there's been more legitimate, like journalists are taking it more seriously because they're having to report on these like, upcoming phase 3 trials, which are just generally taken more seriously when for any disease or condition. So I think that's been just sort of the timing of where we are and where a lot of research has been helpful. Um, but I do still feel like there's a lot of minimization. Like especially sort of around the 5-year anniversary of the start of the pandemic, there was a lot of enthusiasm for people to, I think, like reflect on 5 years, and that a lot of that was put in the past tense and talked about as if it was like this thing that happened so long ago and now everything's fine. And even there were publications that republished like an essay I wrote which calls out all of that, and then like in their caption for on socials was like put everything in the past tense and like completely minimize that. So I think people are trying to get it, and I don't think all of it is malicious, but I think some of it is just the propaganda and the narrative has been so strong in the mainstream media that even well-meaning editors, who should know a lot better, aren't catching it. Betsy, do you have anything else to
Yeah.
kind of?
No, I definitely agree with all of that. I think it's sort of the double-edged thing where like trials and I think also some of the Trump administration stuff have contributed to some more interest, particularly from some of the other science and health outlets. Like a lot of these publications, like we mentioned, Stat, for example, which just republished or co-published a story with us, they're following all of this Trump admin stuff and all of the cuts to the NIH and all of the threats to research very closely. And so I think being able to cite our work or being able to call on us as journalists who are closely covering like this one specific corner of that, I think that's helpful as sort of a resource to the broader media. Um, I also think for some local outlets that we've collaborated with, there's kind of a growing recognition that people with long COVID are part of their audience, are part of any newsroom's audience, no matter if you are topic focused or you are local. Like there are people with long COVID who are probably reading you and want to see themselves represented. So we always try to remind editors of that as well. Miles and I also have the opportunity to speak at the Health Journalist Conference a few weeks back in Los Angeles, and we led a panel with sort of a similar topic, just trying to encourage local journalists in particular, and journalists who maybe cover investigative stories or accountability stories, to really consider long COVID and to make it part of their coverage. So. Yeah, we try to do it wherever we can. Whenever I'm at like a journalism meeting, I will go on the mic and ask some question about long COVID and try and remind people to not put the pandemic in the past tense and all of this I get up there with my N95 and whatever. So, so we do our best also to be like visible kind of representations of this as a major issue and a major community that is worth thoughtful coverage. Um, so yeah sometimes it's hard to say how much it's changing. It's like it is and it isn't. But
Yeah.
um, yeah, the clinical trials that Miles mentioned, I agree. Those are big milestones.
That's super interesting. I really appreciate that perspective. I feel like it probably hasn't changed that much. So, like, that was kind of my bias when I asked the question. So, I was just curious to see if you had a different read kind of from the inside. So, that's super helpful. And I
Yeah.
just wanted to thank you very much for the piece on the BC 007. Really helpful. And it was really interesting. I was on a webinar for the Bezisterim trial this week. And one of the things that they're doing in that trial is it's a much more restrictive trial for enrollment compared to many of the others that we've seen. And, it was really helpful for me. I think that's good thing. It's a challenging thing because it
Yeah.
means that fewer people or a less broad group of people will be able to access the trial. But from my perspective as a patient researcher, we need some of these trials to have the best chances of success possible in order for the funding to continue. And so they're trying to kind of make the best attempt that they can. And so it was really helpful for me to be able to like point to that example that you really, really clearly described. Because I think it's all related, and I think people need to kind of understand how these things work together. So I think it really adds a lot to the field, and I just wanted to thank you for that reporting.
Thank you. Also, we are covering that trial, so
Cool.
you may get an interview request from the
Sure.
freelancer working on
I
that story.
I'm on the patient advisory board,
Yeah,
so that I'm not impartial by any means, but I'm
yeah,
happy to talk to you about.
cool. Miranda, do you want to unmute or put your question in the chat?
Hi, yeah, I just have a quick question in response to this really interesting conversation triggered by Ezra. And I kind of said this in the chat, but I really want to echo everything that Ezra said in terms of appreciating how much work you all have done in the last couple of years in terms of like changing the media landscape. And I think my sort of question, which is also a little bit like, hey, I have an idea. Do you want to do more work? But I was thinking about how much you all kind of set the standard for how people should report about COVID and long COVID and the pandemic, and how much you're doing that kind of outreach work to other journalists. And I'm curious if you have ever thought about creating some kind of style guide or best practices guide that's just like how to write about long COVID for journalists. Kind of like, I've forgotten which organization does it, but there's like a couple of really good media guides for like how to write about trans people. Curious if you would ever do anything like that.
Yes, we actually have a pending project about that that's been moving very, very slowly because of low capacity. But it is a thing that we've been working on, and hopefully, hopefully we will get it out in the next few months. But yeah, thank you.
That's amazing. Thanks.
Yeah. Yeah, there are other questions from the chat we haven't gotten to, or anybody else, if anyone else wants to like come off mute and share something. Angela?
Hi, yeah, this is a side question. So let me know if this is an amateur question because I am new to student journalism. But I am because I'm part of the COVID conscious slash long COVID advocacy group at my university. We did a long COVID awareness walk in March. And and our group is still active, but we haven't had anything recent. I don't know if you're still open to retroactive stories, that type of thing.
Yeah, I think it probably depends on the event. Certainly we have covered like the BCO07 trial, the main news about that came out last fall and it was still sort of relevant to explain more. Um, we did do some coverage, of course, of Long COVID Awareness Day back in March, so it might depend on how that relates or adds. I think specifically if you're thinking about pitching like an essay or op-ed, we are always looking for ideas that are going to really help to bring new ideas to the community or help foster conversation. And specifically things that are written for an audience of other people with long COVID or other people who are COVID conscious or who have ME or have other IACCs. So I think that's always something to keep in mind. A lot of the pitches that we get are more of like, oh, I want to argue that like COVID is still here. And we're like, yes, we agree. Our readers all agree. So I think kind of thinking about that really specifically can be kind of helpful if you're thinking about sending a pitch.
Okay, that actually really helps a lot. Thank you so much. And thank you for putting on this town hall too. This has been really eye-opening and I've been a long time Insta follower. And it's also great to see people who are invested in um spreading, awareness and information about COVID and long COVID and associated conditions. Thank you.
Thank you. Evan?
Hey, first of all, again, as other people have already said, probably more eloquently than I can, thank you for all of your great work. Um, I was just curious, and this may just be because I went through a little period of not reading the Sick Times as much as I usually do, but I'm wondering if y'all have at all covered. I live in New York City, and of course, just recently we had our last COVID PCR testing clinic close, and so I've been wondering if you've at all covered stories like that, even if not that specific clinic closure, and or how these kinds of clinic closures affect the ability to even collect data and get properly accurate data.
Yeah, no, that was such a bummer about that clinic. I actually live near there and have gone there super frequently, so it's just such a bummer, both personally and, of course, the loss of a really important resource for everybody in New York City. So we haven't covered that site specifically, but because there was a bit of coverage of it in other outlets. Aaron Durkin, who is a contributor of ours and is a freelancer based in New York City, wrote a great piece about it for Hellgate, which we shared in our newsletter a week or two ago. So I was like, I would basically write the same thing as her, you know. But I have personally covered New York City's COVID supports and infrastructure a lot. I did a couple of pieces for Gothamist a couple of years ago about COVID testing. I'll see if I can find the links and put them in the chat. And then also more recently, last year, the Sick Times did a collaborative piece with Amsterdam News, which is a local newspaper here, looking more at specifically long COVID infrastructure, including these public clinics run by health and hospitals, and a bit of research that the New York City Health Department has been doing on long COVID. Um, so, so yeah, I think we covered it a bit. We try not to, since we're such a small outlet, we try to really look for stories that haven't been covered by other publications, which was probably the main reason why we didn't write about this the testing site closure specifically. Although we've shared some stuff about it.
Tanya, do you want to go ask a question, or we can put it in the chat later?
Sure. Thank you. I have an idea or thought for a topic which I don't think has been discussed yet um, in your newsletter or on the podcast, and it's specifically the lack of support groups for COVID conscious long haulers and the umbrella of MECFS post viral illness. I'm wondering if there's some kind of story that can be done and covered, maybe with Marked by COVID or Death Panel, but maybe some type of collaboration to say, like, when HIV and AIDS was breaking out, they had life support, which I believe is still going on to this day. It was even featured in a musical scene in Jonathan Larson's Rent. What I'm seeing right now, and I'm wondering if we can cover it, we're constantly losing our friends online, and unless like you're in certain, let's say like Twitter or TikTok groups or Facebook groups, you may not know that some of your friends or community members have even died or when they're going into the hospital or whatnot. And I'm wondering if there's a way that we can talk about the fact that because it's airborne, um, we have a lack of grief support for those that are living, those that are struggling, the lack of support, and then those that have already died, and maybe a way to just talk about that. I don't know how to necessarily wrap that up neatly, but it's just kind of something I would love for everybody to meditate on and see maybe how to best honor that and what could be best done to go forward.
Thank you. Yeah, no, that is a really important idea, and definitely something we'll think about in terms of how to best cover it.
Yeah, I think there are, I there's been some advocacy that have attempted to sort of address some of this. Um, but it's just such a difficult topic. So I think it's something we're definitely, it's seems like it's a story that needs to sort of be looked at from like what a solution could be. So like this type of thing might be a really important sort of op-ed of like what needs to be formed to address this, from like A, within the community, and then B, from like as a stopgap measure, and then B, from what a greater government organization could do to address this and how it could. Like a good op-ed would be, yeah, HIV/AIDS patients needed, people with HIV/AIDS had this certain program, like we need one for long COVID. That kind of framing I think would be really helpful for people to understand like what a program like this could look like.
I think we have time for one more. So Jennifer, would you like to unmute or put your question in the chat?
Hi, I'm new. I've been reading only for the past month. I love your work. And I just had a quick question, and it's dealing with your TikTok page. I'm in so many communities that are COVID aware on TikTok. Now, I did check your page, and you do have, of course, your web page or Zoom or whatever it is. I was thinking that whoever is handling your Instagram page, if they could at least post, you don't have to do a video, but at least if you could get those slides into a TikTok, that would have been helpful. I was actually going to make one for you for tonight, but I just didn't have time. But I just want you to know you have truly an audience there that needs you. They just don't know about you. So I just want to thank you though for all your work, because I do read you more so on Facebook. So thank you.
Okay.
Very much noted. Yes. Yeah. Yeah. TikTok is one of those, like we've been trying to get on there, but it's a lot of capacity. So that's a really great suggestion to post like the slideshows at least. Cool. And I think we're about at the hour, so I think we're gonna maybe wrap it up here. But thank you so much, everybody, for coming, for all your questions and feedback. We really, really appreciate it. If you like think of anything else later, or if you want to follow up on an idea that we talked about, or send a pitch, the best way to reach all of us is editors@thesicktimes.org, which is the main email on our website and everything. It goes to all of us on the team. And like I mentioned, we're going to post this video on our YouTube probably in the next few days, and possibly also as a podcast episode so that folks who missed it live can listen in and get all the info. So yeah, anyone else want to share anything before we close out?
Many thank yous.
Thank you.
Thank you so much, everyone. Really appreciate you coming here and asking us questions and just all of your input. So thank you.
Yeah.
Thank you so much.
Thank you.
Thank you. I'm gonna close the Zoom.